So I think there's, maybe like two key goals that any useful discovery technology should try to achieve. One is reducing time to IND, and the second is increasing probability of success in the clinic. And you know, maybe the biggest problem we have in discovery is the systems in which we measure the performance of our drugs don't have a lot of relevance to the ultimate patients that they're intended to benefit. So, part of the thrust of the company is how do we develop technologies, screening systems that are more reflective of patient biology. And the way we think about this is the AI models are starting to get so good that most of the molecular design you can do entirely on the computer. And now you don't need to do as much testing in the wet lab. And so what that opens up is the ability to, again, do most of the design on the computer and then make a couple hundred to a couple thousand candidates and just directly test them in a setting that's really relevant to patient biology, like maybe primary cells you've isolated from a patient or organoids that you've reconstructed from a patient biopsy, just as some examples of the kinds of things that we do.
Yeah, it's amazing how we've entered this new phase. I met with a company a few years ago that was sort of in this space, and their whole thing was automation. And they were working on an inhibitor, and they said, our automation is so amazing. We were able to try like 300,000 variations of that inhibitor in the wet lab. And essentially what you're saying is that the computational power has become so good that you don't need to do that anymore, and you can just narrow it down so much better on the computer before you get there.
That's right, yeah. And the whole game, I think, is sort of the more of the early screening you can essentially virtualize that allows you to just directly deploy and test in a setting as close to patient biology as possible.